Trial Tuesday once again, and lots of us will be visiting family in nursing homes or hospice care over the holidays. Attorney David Aylor is here to let us know what to look for to make sure our loved ones are getting the proper care. And David, this is something we frequently talk about, especially nursing homes. You know, so I'm going to see grandma. What signs do I really need to pay attention to?
Well, it's really important this time of year because obviously a lot of people travel to maybe where their loved ones are, and they're usually not regular visitors. So it's not a weekly thing where they've been able to check up on them. So now they're coming and maybe only there a few days. One of the most important is looking at the medications that they're taking. You don't have to be a doctor or a nurse to be able to read what they're taking and then look at the bottles and determine if that's exactly what they are taking. Or just ask the nurse or ask the person that's assisting your loved one. You know, it shouldn't be something that they feel offended by. You just want to make sure that not only is it the right medicines, it's the right dosages, because oftentimes medicines will get switched up. Sometimes they'll not be getting what they're supposed to be getting, or a different prescription will have come in and replaced it. So it's very important when you think about just about every single person within these type of facilities are going to be taking different prescriptions. Things do happen, mistakes are made, and those sometimes can be critical errors.
Is that one of the biggest things you see with mistakes with medication?
Well, I think it's just inattentiveness as a whole. Medication obviously is one. Sometimes it's just basic care. You know, you have things that come up such as the bed sores and different issues that come just within the physical room because they're really not getting the treatment that they should as far as an attention standpoint. We also have incidents, of course, with just the facilities as a whole, whether the bathrooms are set up correctly, the showers, that sort of thing, for these people and the disabilities they may have. We also see it on the home health care side, whether it be, you know, towards the end of a person's life with hospice, of course, but also home health care nurses. Sometimes, you know, they may come in, or assistants may come in. You have everything from sometimes things at the house getting stolen to, of course, again, the care not being shown to the patient. Now, I would say it was probably less often because it's more of a direct attention within your home or within their home as compared to nursing homes, but it does happen.
Yeah. How do you look for signs of this? You know, especially if it's a relative who's at a point where they can't communicate with you. How do you know, and so, other than sitting there and watching all day, that they're getting what they need?
Really, you have to be consistent, you know. A lot of times people don't realize it because if they're only coming by once every 6, 8, 10 weeks, maybe it's going to be hard to notice that within an hour-long visit. But if you can consistently stay, you know, also communicating with the nursing home, making sure that you're paying attention, and the place that you put your loved one is just as important. You want to do the research. We've talked about this in the past. You know, unfortunately, you don't want to just look at it from what's the bottom line price point. You want to look at it from the standpoint of where's the best care, what can we afford, and how can we do this. But really staying on top of it, letting the folks at the facility know who you are, who your loved one is, and know that you're watching a little bit, because a lot of these errors could be avoided. Unfortunately, it's really scary the amount of things that actually do happen that essentially cause critical damage to someone, and even death, that if just avoided on a simple level would have, you know, put them in a lot better position.
So what do we do if we visit over the holidays and we just suspect or suspicious that something's not right? Should we call an attorney right away?
You know, I think so, absolutely. If you feel like that there's at least something worth looking at, an attorney can direct you in the right way, even if they feel like that maybe you're not at the point of a case. But they'll also be able to tell you some specific things to look at, or maybe ask you to get their medical records so that they can review them. Some medical expert within their office from the medical field will take a look at it. But it's definitely worth a look. You don't want to just notice something and then hope it goes away or make one call, because again, particularly if you're leaving the area and not going to be able to monitor it yourself on a daily or weekly basis, it's important to get somebody over there to get some attention to it.
All right, Trial Tuesday with attorney David Aylor. Happy holidays.
Happy holidays.
Merry Christmas. Conversation. Yep. Thank you as always, though, for being here. We've got much more.